Patients of the lateral decubitus, we're doing microparticipant liposuction to the back and a fat transfer to the buttocks. We already did the arms, but let me show you. This is the pinch test. See how there is actually, can you see there? No, I'll probably go to the side a little bit so you can see better, but there is no excess fat anywhere we go here, you see? And you have a nice waist on her. We didn't do the front, so of course she needs her abdomen done for a much better waist, but for now we're just doing it in stages. So we're doing this area, and then we'll bring her back into the front area. Thank you. Whitey, so this is the pinch test. Notice how there isn't really much fat in here. You see, I don't know if you can see there. Maybe it's better if I go like this, see? You see? So no excess fat here. See, this is the waist. She's on her side, right? Look at that. So anywhere we go, no excess fat here at the Cosmetic Surgical Center of El Cerrito. Thank you. Dr. Patino here at the Cosmetic Surgical Center of El Cerrito. We're doing ultrasound guided gluteal fat transfer. This is the very, very best way to go so that the patient is protected. We're literally saving thousands of lives by doing this under ultrasound, because this is a blind procedure, and we are doing it so that we can keep the fat graft above the muscle where God put it, between the skin and the muscle. Thank you.
This is a perfect example of why it's really important to use ultrasound and when you're doing a BBL. This is Dr. Patino's cannula, and like just right below, this is the deep gluteal fascia. Typically we see it closer to about right here, but in her case she has a really small subcutaneous space. It's like pretty much at 2 centimeters, maybe even like 1.5 centimeters. So this is Dr. Patino's cannula, this is the deep gluteal fascia, this is the superficial gluteal fascia, which you can see there's a break right here, and that's typical of the superficial gluteal fascia, and this is the patient's skin.
And I'm going to wiggle the cannula, and I'm going to give it a bolus. It'll be like a gray cloud, and that's the fat going in there.
Right. Okay, so we have the fat coming into the space, and you see how there's that gray bolus he's talking about, and the deep gluteal fascia is getting pushed down. Now we have this bulge of fat that enters the subcutaneous space. That's the fat graft.
Thank you.
We can see it's still, you know, the deep gluteal fascia is right here. It's a little deeper than the other side, but not much, so it's still just a tight little window. This is Dr. Patino's cannula, this is the superficial gluteal fascia, this is the patient's skin, and all of this is the patient's muscle. You inject in there, you have big problems. So this is the subcutaneous space where Dr. Patino is going to be giving us a bolus.
So I'm going to wiggle the cannula so you can see it, and I'm going to withdraw it a little bit so you can see the tip of that cannula. You see it? Okay, and I'm going to pay attention to the tip of that cannula, and we're going to give it a bolus. So you're going to see some gray fat entering the space.
Alright, so as he said, here's the gray fat entering the space. It's not that the fat is gray, the fat is yellow, but it looks gray on the ultrasound. And the deep gluteal fascia is being pushed down. As you can see now, we're working with a much wider space, the subcutaneous space, because that deep gluteal fascia came all the way from here, got pushed down all the way to here.
Awesome. Now let's show inferior and superior gluteal veins. The inferior gluteal vein gets hit 80% of the time. The superior gluteal vein gets hit 20% of the time. Example, so the tip of my cannula is right under the superficial gluteal fascia, right? And so if I were to advance it more, I'm gonna go through that. And potentially, I think that's what happens when you destroy this fascia right here.
Right.
You can get a blowout fracture. But in addition to that, I think the body also has a way to reject the blood that's outside the blood vessels. I think it irritates the tissues, it creates fibrosis, and it may even create seromas and even a foreign body type like reaction where the blood is encapsulated and pushed out, and that can happen. The same thing can happen with dead adipocytes. They get encapsulated, they get pushed out. That may be the famous blowout fracture, right? And so here's your cannula. So when I go from the intergluteal superior incision, I don't go all the way. laterally. I just stay in the middle compartment. So I build the lateral compartment first through the superior gluteal incisions and the inferior gluteal incisions, and then I do only the middle compartment with the intergluteal incision, and the medial compartment I do very little, and definitely, and all this is done under ultrasound, but if you want to use ultrasound, that's the place to be, ultrasound. Okay, so I'm going to show you how to locate the gluteal vessels. So you put your thumb on the coccyx, the third digit on the posterior superior iliac spine, and the second digit right in the middle, and that's exactly where your superior and inferior gluteal vessels are. The inferior gluteal vein gets hit 80% of the time, probably around here, and the superior gluteal vein gets hit 20% of the time. This upside not only minimizes the risk of infection, we put 4x4 soaked in betadine, covered with this large upside, or how do you call it, Gabi? Tegaderm. But this usually covers the danger area, that medial aspect where the vessels are. Granted that the vessels are a little farther out, probably around here, like I measured. So that usually there is a line that goes from the posterior superior iliac spine to the ischial tuberosity, and medial to that line is where the vessels are. Usually, roughly, is about 6 to 8 centimeters from the intergluteal crease, but that's just so you know. And notice we're done. We put about 700 in each side, and we still have fat graft that's yellow, nothing red. So basically, the fat graft retention is going to be greater because it's basically pure fat, no blood in there, and obviously, if whatever you put in there looks pink or red, that means there is blood in there. And